How are you?
I'm good. How are you?
I'm fine.
Yeah.
What's your name?
My name is Robert Kassana.
Robert Kassana.
Yes.
You came from?
Tanzania.
Tanzania. Robert Kassana, can you tell me what do you think about media social?
Social media is for me a new way to reach many people with a lot of information, different kinds of information. And it's a new way for people to socialize. We are already in a world with a lot of new technology advances, and almost everything these days has a way in which you can connect with other people. You're sitting in Senegal, you're sitting in Tanzania, you're sitting in Brazil, you can all connect at the same time. If you're sitting in front of your television or on your phone, on your camera, you can basically connect. And there are now tools to enable you to do that. Facebook, Twitter, LinkedIn, Foursquare, everything enables you somehow in one way or another, depending on what you fancy really, to connect.
All of the person think about social media can resolve the problem of healthy youth. Do you agree with this?
Well, it's one way to make a small contribution in making young people healthier. And because social media enables you to share information, because social media is primarily a means for people to connect at a social level, then it means you can use that somehow to influence people with information. We develop new behaviors, and we sort of service our behaviors. We are interested with different things and drive our interests using the social connections that we have with people. And because technology enables us to connect at an even faster level, at an even ready level, then it means we can put in new information as part of that connection to enable people to make better health decisions. So let's say using Facebook, we leave work, or be it at anything that we're doing every day, we sit down almost around 3 to 4 hours a day to connect via Facebook. So if we can make part of the content of the information that they're sharing, part of the information of the things that they're talking about, be about health, then at least we can reach them with positive information. Now, whether or not they'll use that information somehow to change their perspectives and change behavior is another case altogether.
You do something with the boy or the youth who don't live in a big town, who you can get internet. You work in a project whose name is SMS Rapid or Rapid SMS. Can you tell me something about this?
Rapid SMS is a project that has been implemented in Rwanda. Unfortunately, I'm from Tanzania, but from what I've heard about Rapid SMS, it goes a little further, because the social media that we talk about every day, not necessarily the traditional ones that we talk about every day, are the new technology advances. With the proliferation of the internet, you have a lot of tools that have been introduced to the internet, and it enables people to connect. But you go to the villages, you go to the rural communities, it's not easy for everyone to have access to the internet. But how do you continue reaching them with the simplified tools that use technology? And what I've heard from Rapid SMS is that they use the one thing that has penetrated across Africa, across rural communities, which is mobile phones. And what Rapid SMS has told us they do is they use it to communicate information, mostly about the situation of maternal health in the communities. Mothers who are pregnant are able to receive information about the health centers that they can go to, the frequency of times that they can go to the health centers to visit healthcare providers. And this helps at least to provide some means of surveillance to make sure that they are going through their pregnancy safe, they deliver safely, they recover safely, and they go home with their babies in a much safer manner. Compared to before, when you did not really have a means with which you can ensure that they have information throughout the period of pregnancy. So as a means for surveillance, it seems to be working, and what they've told us is that they are expanding and probably upscaling this program at the national level. So if we can learn a lot more from what lessons they have gathered throughout the process, we can replicate this in other parts of the continent.
Let's about karma. What's your perception in karma? What do you think about karma?
I think karma is You know what a glue is, you know. It means to stick and, you know, adheres things together. And for me, karma brings that aspect. Countries are already doing something on maternal mortality. Countries are already doing something on maternal health. They're constructing hospitals. They're putting doctors in hospitals, putting midwives in hospitals and in healthcare centers, and they're improving management of health services. There's already something that countries are doing, but it's not achieving. It was not achieving what it was supposed to. When you look at maternal mortality levels that were there as far back as 2005, when the levels were quite alarming, the introduction of karma has enabled countries to coordinate their efforts much better. So for me, karma brings in an aspect of coordination, brings in an aspect of aspiring to particular goals. And when you look at countries, as we were told, like Sierra Leone, countries like Ghana, countries like Mauritius, it has completely transformed and provided lessons that other countries on the African continent can utilize and work on. So now you have over 37 or so countries that have launched karma. It's not enough to just launch karma. It's important to also transform the values of the campaign into your programs at national level. It won't be something that works for everyone as is. You need to be able to translate, make it relevant to your context.
Last but not least, in the first day in December is the day who digit of AIDS, National AIDS. So can you give an advice for all the youth in the world?
Well, everyone experiences and lives with the status of being HIV positive in different ways. But there are things that we all agree. Once you have been infected with HIV, does not mean it's the end of the world. Once you have the virus, nothing really has to change. Granted, yes, there are challenges of medication, access and using medication, and relating to your peers in society in the same way that you've been relating with them throughout life because of challenges of stigma and whatnot. There are challenges, granted, but at the first level, for me, it's about the individual. How does the individual receive the information about their status, and how do they move forward from that point? If there's any other challenge out there in life that anyone faces, usually the issues of esteem and how you move forward, whether or not you have the confidence to move forward. So even with I'm not simplifying the challenge per se, but even with the onset of HIV, it's not the end of life. We need to continue relating and treating each other the same way that we've been treating each other. And on the other end, we need to make sure that the services that people who are infected with HIV and the life that they need to live from then on in society continues to be the same, but that their needs are also met in society.